Okay, very good morning. Welcome to all of you. So, we are going to discuss today about screening of disease. Screening of disease. You may have heard this word since many days. You are hearing this word since many days. So, routinely, where have you heard this word screening? Screening for disease. In which case you have heard these words since so many days. Screening. This word is routinely used nowadays. Where did you hear this word? Ask your colleague that our class has been started, so to join the class, ask them to join the class. Where did you hear the word screening? We are going to talk about screening for disease. Write down in chat box. Very good morning to all of you, but write down in chat box, where did you hear this word screening? Yes, in case of the corona. How this screening is being done in corona? How this screening is done in corona? You may have seen the pictures, video regarding the screening of corona. How it is being done? Okay, still 30 participants. So many students are still left. Ask them to join. How this screening for corona is being done? You have seen in pictures, photographs, in video. You may have seen that it is being done at airport previously, before 1.5 months at airport. Yes, by measuring temperature. Very nice, Arpit. So with the thermal gun, by measuring temperature. So that is only screening. By if the temperature is above the normal limit, we cannot say that patient is having corona. Rise of the temperature, fever can be because of so many other diseases. But that is only screening, that all the people with temperature can be screened and they can be kept aside. They can be further tested if the history is there. So lots of the disease can be diagnosed at a single time. Shakti is writing, yes, it can be not diagnosed, it can be screened. Here there are two different terminology: screening and diagnosis. Diagnosis is specific for the disease. Screening is just we can screen the patient may or may not have the disease. Ask your colleague to join, because we have the system of attendance over here also. We are regularly sending your attendance. So okay, one more update, actually two more update regarding COVID disease. Previously, we have discussed about that also in separate classes, there were additional classes. So there is, as you know, that previously discharge policy about COVID disease was that before discharge or discharge can be discharge of the patient can be only done if two consecutive samples 24-hour apart are negative. If two consecutive samples 24-hour apart are negative, then only discharge can be done. That was the previous policy. Just one day before, revised policy has been revised discharge policy has been implemented. That even if I mean to say, discharge of the patient can be done after 10 days. We don't have to wait for 14 days. After 10 days, discharge of the patient can be done if for 3 days there is no fever. If patient is asymptomatic and for 3 days there is no fever, so discharge can be done at the end of 10 days without testing. No testing is needed. No testing is needed. So that is the revised discharge policy. Previously, two testing were needed. So what is advantage of this revised policy? Can you write down in chat box what is advantage of this policy? Previously 14 days and two testing were needed. If they were negative, then only discharge can be done. Now no testing is needed, discharge can be done at 10 days. provided there is no fever for 3 days. So what is advantage of this revised policy? Write down in chat box. Advantage of this revised policy. Yes, very good morning to all of you. Still, those students who are joining. I have just told that there is revised policy for discharge. Discharge can be done at the end of 10 days in place of 14 days. With now, no testing is needed for discharge. What is advantage of this policy? Can you think of that? I'm waiting for your reply. Testing time can be lessened. Sakti is writing, saving the time. Yes, we don't have to test, so there is nothing related to testing time. Saving the time. Can you further elaborate? Anyone further elaborate? In place of 14 days, we are discharging at 10 days without testing. Now, no need of testing. Chances of other patient admitted easily, yes, that is one of the advantage. We can save the 2 testing kits per patient, very nice, yes. Most importantly, recovery rate will be higher. Recovery rate now will be higher. Recovery is now previously considered when only there was negative testing. So now there is no testing. So and at the 10 days, so recovery rate is higher. Then also there is space for remaining for next patient. Yes, I'm getting reply. Another patient can be admitted. So patient's load on health system can be decreased. So there will be space for another patient. We don't want that another patient come, but the load will be decreased. So a recovery rate that you may have seen in today's newspaper that early morning you can see that yesterday about 454 patients in Gujarat recovered. That was the highest number of the patient recovered ever since the corona started in Gujarat. So that is advantage. Recovery rate is higher. Okay, so that was another update, that highest number of the recovery patients. Another update is that I have seen just in US, yesterday there were a record decreased number of the cases. Generally in US, every day 25,000, 30,000 patients are diagnosed with the corona positive, tested positive, 25 to 30,000. Yesterday there were 20,000 only, 20,300, something like that. Although the world's number is not decreasing, it is stable around 80,000. But in US, there was decrease yesterday, what we have seen. Already in Spain, Italy, and in other countries like France, Germany particularly, there is decreasing trend. Germany has brought its graph at very low level. Less than 1,000, less than even 500 cases are daily diagnosed in some days. So our topic is screening for the disease. So we have seen the definition. So we are going to see the definition of the screening. Let me take the pointer. That is highlighter, then the ink color. Okay, so definition is the search for unrecognized disease. Search for unrecognized disease. So as you know that in case of the corona, we are taking the current example. Many patients are asymptomatic or mild disease, so they may be unrecognized. So we are searching for them with the help of the screening method. So what we were doing in airport or many times in any entry point of any organization, any clinic, all this is going on. That is with the help of the thermal gun. We are searching for the unrecognized cases. That is even if there is fever, we can say that patient might be having corona. So unrecognized disease or detection by the mean of rapidly applied test. So rapidly applied test. So detection by rapidly applied. Remember this word, rapidly applied test, because here rapidly we can screen the person with the help of the thermal gun. We don't have any laboratory diagnosis needed. For example, in another disease like in malaria, that is actually diagnostic rapid antibody test. That is also a diagnostic test. Then peripheral smear, that can be a screening test, that can be actually diagnostic test also. So, or examination or other procedure in apparently healthy person. Remember that this screening is done in apparently healthy person. So in airport or any entrance point, we are screening all the persons. We consider them they are healthy, but we are screening with the help of the thermal gun, that is screening. So again, I repeat that the search for unrecognized disease, screening is search for unrecognized disease or detection by means of rapidly applied test. The test should be rapidly applied, because we have to screen so many persons or examinations or other procedure in apparently healthy individual. So strictly speaking, screening is testing for infection or disease in population or in individual who are not seeking health care. Actually, what happens that patient comes in OPD for seeking health care, but patient who are coming from airport, going to their home, they are not seeking health care, but we have to screen them for corona. That is best example suited nowadays, so I'm repeatedly speaking about it. Patient who comes in your OPD, we write down the investigation. That is not for screening, that is for diagnosis. That is for diagnosis of the individual person's individual condition. Screening is applied in population, in mass, not in single person actually. For another examples are serological testing for AIDS virus in blood donor. In each and every blood donor, whatever blood is collected from it, sample is taken and it is screened for a presence of the HIV. If there is presence of the HIV, that blood cannot be donated to another person. So that is the screening in each and every blood donor. Neonatal screening for the congenital disease, for any defect, congenital defect. Premarital screening for syphilis, premarital screening for thalassemia. In certain caste, including Lohana, including that Sindhi, Punjabi, you know that thalassemia is more prevalent. So before marriage, both bride and groom, both that thalassemia screening is done. So that is prenatal screening for thalassemia. So that is the basic concept of screening. It is applied in healthy person with the help of the rapidly applied test and to know about unrecognized disease. So genesis of the screening, they are based primarily on observing physician time for diagnosis and treatment, having technician administer simple, inexpensive laboratory test, or many a times without laboratory test. Screening can be done with the help of just physical examination, like in case of the neonatal screening, congenital defects. So defect is visible, outer external defects are visible. So here no laboratory test is needed. Suppose cleft lip or cleft palate is there. By just looking at the mouth of the neonate, cleft lip or cleft palate can be examined. So each and every neonate is screened for all the congenital diseases like cleft lip, cleft palate, then this cataract. For cataract, there is of course physical examination in form of light. We have to throw light in the infant's eye. Then for other congenital disease like tetralogy of the Fallot or congenital heart disease, pediatrician have to examine with the help of the stethoscope. Even RBSK doctors, you know about RBSK, Rashtriya Bal Swasthya Karyakram. You have the opportunity after passing your UG, you can join the RBSK program in which you have to do this neonatal screening. You will learn how to do neonatal screening, how this all the congenital defects can be. That is the first D. In RBSK there are 4D. Among 4D, that is first D. This is deficiency. That is defect. So this defect can be diagnosed with the help of screening. So in congenital heart disease, you have to use stethoscope. An original screening program where for individual like tuberculosis, for disease like tuberculosis, syphilis, but over the years, screening tests have been steadily grown in number. So many screening tests are there now in number. Screening is considered as the preventive care. See, screening is for preventive care. Diagnosis is for treatment. Screening and diagnosis, this is another difference. Screening is for preventive care. We are preventing. Suppose we are screening the persons for corona. So we are preventing infection from transmission from one person to another person. And some consider as the logical extension. Just a second. Logical extension of the healthcare. So mainly it is for preventive. So another terminology you need to understand, that is lead time. So please pay concentration over here. We are going to see about lead time. The concept of lead time in screening is very much important. So lead time is what? It is the advantage gained by screening. Advantage gained by screening. For example, in case of the corona, we are screening the patient at the airport previously before 1.5 months. So if screening was not considered at that time, if screening was not done, that person who is asymptomatic or mild, who is suffering from corona, that cannot be screened at the airport, or that person arrives to the country, and that if they develop the disease, then diagnosis will be late. In place of that, we are screening them, we are causing early diagnosis. So that is the early. So we are talking about the lead time, early diagnosis. That is the period between diagnosis by early detection and diagnosis by other mean. Again, I repeat that lead time is what? Remember this definition: period between diagnosis by early detection. Suppose we diagnose on the arrival. We diagnose on the arrival. I mean, to the screen. And if the patient is not screened and it is diagnosed after 5 days, so that 5 days period, that is the lead time. That is the period between diagnosis by early detection and diagnosis by other means. So in this period, there are usually number of critical points which determine both severity of the disease and the success of any treatment in reversing the disease process. So if we diagnose early diagnosis helps in patients better treatment, patients better recovery in any disease. Although in case of the corona, recovery rate is higher, as well as in more than 90% patient, the disease is asymptomatic or mild. So screening program should be therefore concentrating on the patient's condition where the time lag between disease onset and final critical point are sufficiently long. So that is lead time. You have basically understood about that. So what are the aims and objectives of screening? Early detection and lifestyle changes. By the help of the screening, we can detect the patient early. Then we can, in case of the disease where lifestyle changes are needed. For example, in corona, always it is not lifestyle disease, but here lifestyle changes are needed. You know that lifestyle disease are diabetes, hypertension, cancer, the non-communicable disease. But here lifestyle changes is even needed, that we are currently experiencing like that. If the patient is screened early and diagnosed of having corona, then hand hygiene, social distancing, all these lifestyle changes are needed here. Early intervention. So early detection will lead to early intervention. Early intervention in form of the care, in form of the treatment and management. Surveillance activities. As you know that surveillance is what? That is the search for the cases. For example, in any area, if COVID positive patient is diagnosed, so in that area, search for another cases are being considered. You are aware of that news, all the news. So search of the cases for more cases are considered. That is surveillance. To reduce the risk of disease and to reduce mortality and suffering. So these are the aims and objective: to reduce risk of the disease, decrease mortality and suffering. Target group. So to whom screening should be considered? Screening should be considered in person with the family history of the disease. For example, in case of the thalassemia, here we are talking about the family history. If the parents are having thalassemia, if one of the parent is having thalassemia, so screening for the thalassemia should always be considered regardless of the prevalent caste which we have mentioned. So before marriage. For example, another example, parents are suffering from diabetes, hypertension or cancer, then screening can be always considered in their son, grandson, etc. Person with occupational, so target group, we are talking about the target group for screening, person with the occupational exposure to the disease causing substance. So, for example, in case of the pneumoconiosis, or coal workers pneumoconiosis, in which persons are working in coal, so here occupational exposure to coal is considered and screening can be done for searching for the coal worker pneumoconiosis. For example, in corona, those who have duty in COVID positive ward, those who are serving in COVID positive ward, after some time, after 7 days usually nowadays, they are being quarantined, and after the end of the quarantine, in them they are tested for this RT-PCR. That is also one kind of the screening for occupational exposure. In pregnant women, in each and every pregnant woman, screening for certain conditions are always done. That is for hemoglobin, searching for anemia, HIV, hepatitis B, syphilis. So this HIV is always done in each and every pregnant woman, regardless of any history. HIV testing is done. So that is in pregnant women. Worker responsible for the lives of others, such as for pilots, for bus driver, for pilots and for drivers, screening for their, particularly for their vision. Vision is done, that their vision should be intact. So as well as in case of the doctors also nowadays for COVID, who has worked in COVID area. So these are the target group: person with the family history, occupational exposure, pregnant women, and workers responsible for lives of other pilots or bus driver, etc. Okay, so till now you may have understood about what is screening, what are the aims and objective of the screening. So write down in your words that what is screening, what you have understood about screening. What you have understood about screening, write down in words. We have talked about definition of the screening. So write down what is definition of the screening, or what is screening in your words. There are 63 persons online. Still so many are offline. So awake them, make them awake, and say that attendance is being regularly sent. It is being regularly sent. So yes, I'm getting reply. Primary preventive care, which is done in healthy person. It is actually preventive care. What is, we are talking about the screening. Preventive care, it is general term. So I'm getting period between diagnosis of early detection and diagnosis by other means. So that is not screening. You have told about, you are talking about lead time. Lead time. Screening. Screening is applied in whom, for what, which purpose, that you have to write down. It is the test for preventing disease for large number of the area. Okay. We have talked about definition of the screening in some different way. Screening is done in whom, in which kind of the persons. We're not talking about a target group, but in general, one word. Waiting for your reply. Waiting for your reply. It is the way to prevent disease. Search for the unrecognized. Yes, very nice. Search for unrecognized disease. This is one word, unrecognized. Now say that it is done in which kind of the persons. Unrecognized. 2 or 3 words are important in describing screening. First is unrecognized disease. Searching for unrecognized disease. Yes, by rapidly applied test of examination. Very nice. Okay. In among healthy persons. Search for unrecognized disease by rapidly applied means of the testing in healthy persons. Yes. So that is screening. Okay, to prevent disease. Very nice. Okay. Now further, screening differs from periodic health examination in the following respect. So it is not periodic health examination. It is not investigation. It is not investigation for diagnosis actually. So screening is capable of wide application. It can be applied in mass. It can be applied in large number of people. So it is for wide application. It is relatively inexpensive. So screening. So for example, here in case of the thermometer gun, that thermogun. Once you have purchased this thermogun, it is very cheap. The thermogun is of course costly, but every time you don't have to do the expense for screening. So only that, so that is relatively inexpensive. So whatever the screening tests are there, those screening tests are relatively cheap than the test used for diagnosis. For example, test used for diagnosis is RT-PCR, which is costing around 4,500 rupees. So as compared to that, the thermogun, if it is one time 4,500 rupees expense for thermogun, then it will diagnose, it will screen for so many persons. It requires little physician time. As you know that using thermogun will require only just a fraction of second, you will get the temperature. In case of the RT-PCR, it will need more time, 4 to 6 hours at least. In fact, the physician is not required for test. Here, in case of the corona, even physician, even doctor is not required for the screening. You know that any person who is just aware of using the thermogun can easily screen. If the temperature is above normal range, then that person can be kept apart and sent for further examination, further history. So here, even doctor is not needed for screening test, but interpretation only doctor is needed. So again, advantage is capable of wide application, relatively inexpensive, relatively cheap, require little physician or no physician time. Again, that is screening and diagnostic test. Difference between this: screening test is not intended. It is not desired or not intended for the diagnosis test. It is only minimal examination, initial examination. So difference between screening test and diagnostic test, it is done on apparently healthy person. Here diagnostic test is done on sick patient with the indication of the sick patient. It can be applied to the groups. Screening test can be applied to the group. It can be applied to the single patient. Here the test result of the screening are arbitrary. Arbitrary means it may be not conclusive. Means we cannot say final that patient is suffering from this disease. We cannot say like that. So arbitrary results. But these are final. But finally we cannot diagnose. Diagnosis is again, it is also not final. There can be also differential diagnosis. There can be, but depends upon the condition and depends upon the test. In many cases, suppose in case of the rapid diagnostic test for malaria, if a pulsable positive is PF is positive, PF band is positive, we can say it is final. So it is not it is misnomer. You cannot remember this final or not final. You can cut down. So it is not like so. It is less accurate. Screening test is less accurate. Yes, we cannot finally say that patient is suffering from this disease. Here it is more accurate. Again, I repeat, screening test is in healthy person, it is in sick person, it is screening test applied in groups, diagnostic test applied in single person. It is less accurate, it is more accurate. Test results are arbitrary. Here test results are arbitrary. Again, screening test is based on one criterion. Here, based on evaluation of the number of symptoms and lab finding. For example, one criterion in screening test for fever. Here, with the help of the thermogun, we are just measuring fever. That is one criterion. But here, the diagnostic test it is based on number of symptoms and laboratory finding. Less expensive, screening test is less expensive. Diagnostic test is more expensive. Screening test is not the basis for treatment. Based on the screening test result, we cannot treat the patient. Suppose only fever is there. So there are so many conditions of the fever like malaria, hepatitis, so many other cholera, typhoid, so many conditions are there. Not only corona. So it is not the basis for treatment. Diagnostic test is used for the basis of the treatment because the result is considered final, right? Initiative comes from the investigator or agency providing care. And here initiative comes from the patient. Patient wants about the disease. Here initiative is coming from the provider side. We are screening at the airport. We are screening at the entrance of the shops or entrance of any big organization. So initiative comes from the agency. Here patient is not wanting, person is not wanting for this to be done. He or she is not demanding. Here the person is demanding for their complaint. So these are just I am keeping this slide for 1 or 2 minutes. Read this difference. Read the difference. I will ask later on and try to remember. Okay, so uses of screening for case detection, for control of the disease, Best example, corona. For research purpose, for educational opportunities, case detection, control of the disease, research purpose, and for educational opportunities. So first of all, case detection. So it is called as known as prescriptive screening. By prescription screening is done. So defined as the presumptive identification of unrecognized disease which does not arise from patient's request. So neonatal screening is best example. Each and every newborn is born, mother is not requesting that my newborn should be screened for congenital disease. It is being routinely done by pediatrician. So that is for case detection to identify any congenital defect. So here mothers or parents, they are even not aware that pediatrician is going to screen for it. That you know that during each and every labor, pediatrician is present in each and every hospital. Pediatrician is called for delivery also, and he's assisting in neonatal part. So neonatal screening is done by pediatrician. Here patients are not demanding for that, but it is the routinely done. So that is for case detection. So here the people are screened primarily for their own benefit, as well as for the benefit of the community also, even for the benefit of the community. For example, in case of the blood donor, all the blood donors are screened, the blood of the all donors are screened for HIV. So that is for community benefit. For in case of the pregnancy, all the pregnant women are screened for HIV. That is for benefit of the person, here herself, that pregnant woman herself. Specific disease sorted by this method are breast cancer, cervical cancer, diabetes, iron deficiency. If we talk about the diabetes, according to NPCDCS program, or shortly known as NCD, that is non-communicable disease program, each and every person who are at above 30 years of age, who are attending government OPD, should be screened for blood glucose. Blood glucose level of each and every person attending OPD of government system should be screened in by PHC or in CHC or in health and wellness center everywhere for be screened for diabetes. If you will be working in government health system in PHC or health and wellness center as RBSK doctor, you will have to do this also, and you will have to regularly send the report for the same. Even for this cervical cancer, breast cancer, and iron deficiency HB, we can say that. So that is the mass education. You can see that for cervical screening, people are educated. For cervical cancer, women are educated, and that is the method for cervical screening. With the help of this speculum, cervical smear is taken. That smear is to be taken. Cervical sample is taken with the help of this spatula. This is the spatula, and the cervical smear, it is taken. You can see in this photograph also that at the end of the cervix, this spatula is kept, and over this slide, this is the slide over which spatula is moved for making smear, peripheral smear. That is for cervical cancer. Second use is control of the disease. Use of control of the disease. So this perspective of the screening, prospective screening, people are examined for both benefit of the others also. So screening of the immigrants who are coming from the other country, immigrants for the infectious disease. Common example here, corona. Even TB and syphilis, that is theoretical, it is not being done, but you have experienced this, you have witnessed this in form of the video, in form of the photographs. So that immigrants who are coming from outside, they are screened for corona. Immigrants, it is there can be many types of the immigrants. One is from other country, one is from nowadays from other district. Even you move to other district, then also screening is done. So inter-district visa is only available if you are healthy. Screening of the streptococcal infection to prevent the rheumatic fever. Screening program may be leading to early diagnosis. So we have already discussed that with the help of the screening program, early diagnosis and treatment. So the lead time, we have the advantage of the lead time. So that can permit more effective treatment, early diagnosis, so more effective treatment, and reduce the spread of the infectious disease and mortality. It reduces the spread among the community, reduce the spread of the infectious disease with the help of the screening, and also it reduces mortality. So that is for control of the disease. For research purpose. Screening may be sometimes performed for research purpose to know the history of many chronic diseases like cancer, like hypertension. So it may obtain more basic knowledge. Screening is done for research purpose. It obtain more this basic knowledge. Initial screening provide a prevalence estimate. So if we don't know about any condition, so prevalence of the any disease can be estimated with the help of the screening program. Suppose we in certain district, suppose in Andaman Nicobar, we don't know how much anemia is prevalent. So we screen some sample of the persons. We don't have to screen all the residents of the Andaman and Nicobar. We will screen some samples, say for 5,000 sample for HB estimation. And we find that in 30% there is anemia. So that we can say that in 30% of the residents of Andaman Nicobar there is anemia. So that is for research purpose. Educational opportunities. Screening is also performed for educational program, that is for acquisition of the information for public health relevance. So information regarding public health relevance can be also obtained with the help of the screening. Provide Okay, unfortunately, connection was lost. I have asked that what is difference between screening and diagnostic test. Ask your colleague that our discussion has started. Our discussion has started. What is difference between screening and diagnostic test? What is difference between screening and diagnostic test? Ask your colleague that we are going to still discuss for 10 minutes. What is difference between screening and diagnostic test? What is difference between screening and diagnostic? Yes, I'm getting reply. Screening is in group and diagnosis is for one person. Yes, very nice. Screening test is done in healthy and diagnosis in sick patients. Screening test is less expensive. Diagnostic is more expensive. Very nice. Okay. Any other reply? Any other reply? Screening is done on healthy person. Yes. Okay, so we are moving further for types of the screening. For types of the screening. Yes, three types of the screening: mass screening, high risk or selective screening, and multiphasic screening. Multiphasic screening. I think before that you have all attended this educational opportunities, or at that time connection was low. I don't know. Educational opportunities screening is for research purpose, for control of the disease and case detection. Is it done? Is it done? Uses of the screening. Write down in chat box all the uses of the screening. Is it done? Were you all present during that time or connection was lost? Description of the uses of the screenings: case detection, control of the disease, research purpose, and educational opportunities. Is it done or not? Up to the educational opportunities, was it over? Were you all present during that time? Okay, sir. Yes, sir. Done. Okay, fine, fine. So we are now moving further. That is for types of the screening. Let me select the pointer. So mass screening, it is not working. That ink is not working. Let me select another ink. No. Yes, it is working. For high risk person for selective screening and multiphasic screening. So mass screening, as the name suggests, mass, it is applied in mass. Organized periodic procedure performed on large group of the people. For example, we are screening persons for corona. That is also mass screening. It is offered to all irrespective of the particular risk individual. So this procedure is received the support in the past, but it was subjected not to discuss like that. Indiscriminate mass screening therefore is not useful for preventive purpose. We should have the controlled mass screening. High risk for selective screening. For example, I have given the example that above 30 years of age, persons attending OPD, these are diagnosed as for blood sugar. So 30 years, here age is the high risk. So as you know, the diabetes is prevalent in elderly. Previously, it was in more than 40 years. Nowadays, for more than 30 years. So below 30 years, this is low risk group. They may not be suffering from the diabetes. So high risk group is above 30 years. For example, another example, we can say that screening for the cervical cancer or breast cancer in women above 40 years of age, 45 years of age. So elderly women who are at the high risk, for them, this selective screening or high risk screening is applied. So screening is most producive if applied selectively to the high risk group. We have discussed about two examples. Here also there is example cancer cervix in upper social group, then cervix of the screening for cervix cancer in lower social group could increase the yield of the new cases. So just remember whatever the example I have spoken, simple example in according to the age. By screening for other member of the family for detection of the additional case like diabetes, hypertension, breast cancer, that is similar what we have discussed. So nowadays epidemiologists have extended the concept of the screening of the disease for screening of the risk factor. Elevated serum cholesterol in high risk persons who are suffering from coronary artery disease. So in person with coronary artery disease, serum cholesterol for screening. So risk prediction, with the help of the screening, we can predict the risk. The coronary heart disease prevention Heidelberg. So estimated 10-year risk. If the serum cholesterol level that is based on the coronary heart disease or diabetes mellitus. So low risk is less than 10%. And intermediate risk and high risk, that is based on the investigation. If your serum cholesterol level, it is not written. If it is below certain limit, then low risk level, intermediate risk and high risk, that is 10-year estimated risk. Multiphasic screening, that is examination of the population for several diseases, so many diseases. Multiphasic screening can be done. So multiphasic, here the phases, we need to understand what are the phases that are used. Phases what are used is first phase, that is health questionnaire. I have told you the example of the health questionnaire about the screening for tobacco use. Health questionnaire, then clinical examination. First of all, patient have to fill this questionnaire or have to answer that. Whatever the questionnaire can be filled by investigator, by doctor also, and patient have to answer that. Then clinical examination, that is in form of the inspection, palpation, all the clinical examination steps are carried out, and then range of the measurement or investigation, lab investigation, chemical and hematological investigation. So here history, health questionnaire is what? It is history, clinical examination, and third thing is health investigation. So all these three are multiphasic screening. So screening test valuable will be only when there is ability to detect the potential problem. Screening test will be only valuable at the time when it can detect the potential problem while minimizing unclean, ambiguous and confusing results. There should not be any confusing result. Positive hoy pan sake, na hoy pan sake, એવું નહીં. Equivocal results are not useful. So screening test, we will discuss the criteria of the sensitivity and specificity also. So that is all about initial part of the screening test, and then we will discuss later on about more things about the screening, that is sensitivity, specificity, everything. Okay, thank you very much.